So our robotic surgery curriculum for our residents integrates several different aspects that are important for being a good surgeon and being a safe surgeon. The first aspect is simply the technical part of it. How does the robotic platform work? How do the instruments work? What instruments do we have available? And how can you be safe with those instruments? The second aspect of the education is the technical proficiency of getting good and safe access. You have to have different ways to access the patient's abdomen robotically. And then the third aspect of the robotic training is procedure specific. So we take the residents through certain procedures, for example, something like removing a gallbladder or fixing an inguinal hernia.
My experience in the robotic lab has been instrumental in just kind of my development as a surgeon and as part of this training curriculum. We have had multiple labs where we've gotten to go over just several techniques, including the TAR that one of the ones doing today. And it's just been very crucial to go through the steps and to have key feedback.
There is an emergency undocking course where we are responsible for not only leading a team in how to respond to robotic emergencies that might require undocking, but also skills such as placing in trocars and stopping bleeding. So going through some of these procedures and these skill labs will help us in terms of leadership, managing a team, and then also the physical skills of how to undock and dock.
So surgery is an endeavor in lifelong learning. Even after residencies, formal training, surgeons are required to learn new techniques to offer our patients the highest quality in surgical care. Simulation labs like this we're running today at an institution like Mighty allow for lifelong learning regardless of what advances are made in surgery after their formal training.
Going from never having done one of these procedures to getting through a good majority of it, essentially with just minimal coaching, is really helpful. It's great to learn from experts in the field on how to properly do these procedures quickly, efficiently, and safely.
It's really significant to be able to invite a visiting professor to probably give them a little bit of a different perspective on what they're used to. There's many ways to do hernia repairs. I think with my addition here and my inclusion into the program, I'm hoping that I showed the residents as well as the attending surgeons and faculty a different way to perform similar techniques that they've already been doing.
It's a very cumulative process. We emphasize safety, we emphasize good surgical skills, and really excited to take our residents through this learning process from start to finish.